My name is Shirnett Matthews, and I am a radiation oncologist. I am actually from Jamaica. I was born and raised for 9 years in Jamaica, and then I came to the United States and did most of my training here, and I've been here that long. I trained at Medical College of Pennsylvania, and then from there I went to University of Maryland to do my residency in radiation oncology. Why did I choose radiation oncology? Well, that's a very interesting question and kind of a long answer that I'm going to try to shorten. Radiation oncology actually chose me. I was a nurse before I became a physician, and I worked in critical care open heart recovery, so naturally my path should have taken me into critical care or maybe even into surgery. But when I went into medical school, I really disliked every specialty for many different reasons, and really did not see myself practicing full-time in any one specialty. I felt that it would have stressed me out. So in my fourth year, when I was supposed to declare my specialty, I was in a state of panic. And to make a long story short, I was at that time doing my surgical rotation, which I thought was where I was going to end up. So I thought this was my dream rotation and ended up just hating it. I hated being in the OR. I did not want to be there. And I'm like, oh my Lord, what am I going to do now? And so it happened to be, I think the Lord just prepares us for things and put people in our path that we need to help us make our next decision. And I happened to be with a chief resident who took an interest in the fact that I was really, really stressed out, had me write my pros and cons down. And when I was finished writing my pros and cons, and we had a conversation, obviously, he goes, "You're a radiation oncologist." And I'm like, "What is that?" And he was like, "The only reason I know that you're a radiation oncologist is because your pros and cons list looks just like my best friend's, who's a radiation oncologist at MD Anderson." So I did a rotation with a radiation oncologist, and here I am, a radiation oncologist. What keeps me interested in my work are the patients. Having had a nursing background, that's where my love has always been, taking care of patients, giving my best to the patients, and just seeing that their needs are met. We know medicine. It's not about me. They're being diagnosed with a life-changing event, and I feel I am there to be their help, to sometimes be the psychologist, the social worker, to provide the information. And at times, you're the only support system that they have, and I take great pride in that I'm helping them through one of the greatest stressful, just overwhelming situation in their lives. And I feel like sometimes I have to be their cheerleader as well. And so that's why I do what I do. Unique skills in my specialties or area of interest. Well, I love taking care of women. So mainly the cancers that I treat are cancers that affect women. I mainly do breast cancer. I also do gynecological cancer, including cervical cancer, endometrial cancer, and lately I've also picked up lung cancer, which has also been increasing in women. That's always been a drive of mine, empowering women. I feel that women tend to put themselves behind everybody else in their family and take care of themselves last. And I feel like someone has to be there to empower them to take care of themselves. And even though when they get to me, maybe some of the things that they could have done to prevent or at least early diagnosis is a bit late, but at least I feel like I'm there to help them make better decisions about taking care of themselves and putting themselves first through this fight that they're facing. I think my style of practice really involves empowering the patient and putting them first, putting them in the center. Everything that we do revolves around the patient. So for instance, when I do a consultation, I try my best not to use medical jargon. I feel like if I see my patients face this confusion, then I've not done my job right. I think my job is to let them understand what is happening to them, what is about to happen to them, the side effects, everything that's upcoming, because they need to embrace this. This is a lifestyle, a life-changing event, and I have all the knowledge in my head. So what? If they don't understand it, then I failed at my job. Again, that's another scenario where Prisma Health chose me. I lived in New Jersey at this point after my residency, and what I like to do is gynecological malignancies, and brachytherapy is a big part of that, and that was part of my fellowship training. I actually did a rotation for a few months in MD Anderson in brachytherapy and really wanted to do that, and was actually looking for a job. And a friend of mine introduced me to a headhunter that she knew, and he was like, "I have the perfect job for you at Prisma Health." Well, at that time it was GHS, but that's kind of where we are. And again, job chose me. My interest outside of healthcare, and it also goes along with something that most people don't know about me, is that I'm a born-again Christian. Of course, religion is not something we can ever bring up when we're talking to patients, but I think a lot of people pick that up in my conversations with them, not that I'm, oh, God is or God is not. It's just your presentation. It's just the strength of what you believe. It's that. And so I pray for my patients, whether they want me to or not in the consultation, but when I'm away from my patients, whether I'm in my office or not. And I think that's something that I feel I can do for them. I believe in prayer. I have a lot of faith, and I believe in healing. And my patients don't need to know what my faith is. They don't need to know that I do that for them. But that is something that I feel very strongly about. And I may not be able to discuss that with them because legally we cannot, but at least I know in the background I'm doing that for them. I think the advice that I give to patients that they find most valuable is to just stop and breathe. It's overwhelming. I tend to say it's like drinking from a fire hydrant. It's a lot of information coming all at once. It's a lot to deal with. It's a lot to maneuver through. And a lot of times patients believe, oh, my cancer is growing, I gotta do. And a lot of times it's just stop for a second. Take a deep breath. Process what is going on with you. I even encourage second opinions. I think it's very important that patients buy into their treatment, and trust is very important. And I think sometimes knowing that we're all saying the same thing, or that we are willing for them to go seek a second opinion and get more advice about their care, I think empowers them somehow and make them realize that we are really in it for them. It's not about the money, because healthcare has become a business. It's not about the money. It's really, really about the patient and giving them the best care possible.